Hello and welcome to today's Cafecito. My name is Juan Proaño and I'm the new CEO of LULAC. From September 15th until October 15th every year, we celebrate Hispanic Heritage Month. During Hispanic Heritage Month, we celebrate more than just vibrant festivities and rich traditions. We also recognize the indomitable spirit and invaluable contributions of Hispanics across the country. Did you know that the month spans from September 15th to October 15th, specifically to incorporate the independence of several Latin American countries, including Costa Rica, El Salvador, Guatemala, Honduras, Nicaragua, Mexico, and Chile? This month is also a reminder that every month is crucial for our community to be represented in the arts, business, our government, and so much more, including healthcare and health research. With me today, I want to introduce a special guest. Her name is Erika Ruiz. Erika holds an influential role at Interwell Health with 2 decades of experience spanning hospitals to dialysis clinics. Her experience is undeniable. As a bilingual renal service coordinator, Ms. Ruiz is profoundly committed to effecting change with a particular emphasis on serving the Hispanic community. In addition, she holds a significant position with the DEI Committee and the Latino Employee Resource Group. A notable initiative under her guidance is a specialized program catering to Hispanic kidney disease patients in Puerto Rico. In this capacity, she and her dedicated team extend vital resources and unwavering support to the community. Erika, welcome, and thank you for joining us.
Thank you, Juan, for having me today. This is a real pleasure for me. I appreciate that introduction. And yes, I have had about 2 decades of experience in the healthcare field, specializing with kidney disease the last 10 years. And working with Interwell Health, I am very fortunate to be able to work alongside a great team that is really focused on Hispanic population currently. This is a new initiative in Puerto Rico where we are focusing on helping our patients and finding all the resources they need to maintain good kidney health. So thank you so much once again for having me. I am very excited to be here.
Wonderful. Well, it's a pleasure. Now, are you in Puerto Rico right now?
I am. I'm currently in Puerto Rico, first time. So this definitely is a different Hispanic Heritage Month celebration for me. I am of Mexican descent. It's just Puerto Rico first time, like I said, visiting, and I'm loving it. I don't know, I might end up staying.
It is a beautiful, beautiful place. I hope you get to enjoy it as well.
Thank you so much.
So let's talk about a couple of things, right? So healthcare is not a one-size-fits-all for everyone, right? The needs are really different, specifically in our community. What's your experience when it comes to the type of treatment, if you will, and even maybe some of the research that goes into serving our community?
Yes, definitely. A great question. Thank you, Juan. Honestly, I think being a Latina, not just working in the healthcare field, but also with my own personal experiences, getting, treatment and care, I have found that, like you said, it's not a one size fits all. And sometimes we do feel underrepresented in the type of lab work or in the type of test or in the type of treatments that we are able to really find to help us. And so this has been something that, working in the field, obviously I've learned that a lot of these diseases like chronic kidney disease does affect certain ethnicities, and there is a faster rate of disease progression. And we have increased risk factors such as diabetes, hypertension, and cardiac issues, which have contributed to increased cases of kidney disease with these groups, in, like, for example, Hispanic and Black Americans. So it isn't a one-size-fits-all approach, and that's why I feel like all of us research is really a great opportunity for us to change the way healthcare is done.
Yeah, healthcare is really changing with the advancement of technology, data and data analysis. It really, provides a bright spot for the future. I had come across an interesting data point from 2021 in the Journal of American Medical Association, which found that Hispanics or Latinos and individuals made up less than 12% of the participants in health research, and as reported by ethnicity. But more than 90% of those participants in the larger genome study were actually of European descent. That doesn't really bode well for Latinos. when it comes to clinical research.
Right, right. And that's why learning about All of Us research, I really have found that it's such a great program to give the opportunity to all ethnicities a chance to participate in health research that will bring more of medical breakthroughs and practice among our diverse communities. We need that extra support. I really do believe in the values and the commitment that they have to represent us. And in this, the mission, of course, for All of Us program, which is to accelerate health research and prevention, treatment, and care of us all. I believe that that's just a great way for us as Hispanics to step out and make those steps towards the right research and do what we can to participate in these type of programs.
Yeah, one of the things that LULAC does is, we advocate for representation, right? We advocate for representation across a different spectrum, right? In the federal government, at a state level, even at a community level. And so one of the things that's really important for us is to also have proportional representation when it comes to these research. So that's why LULAC is proud to partner with All of Us research program. All of Us is run by the National Institute of Health. It's inviting 1 million people across the United States to help build one of the most diverse health databases in history. Participants of all backgrounds are welcome to currently participate, and over 705,000 have already enrolled. 16% of those are Latinos. It's pretty incredible, don't you think?
That is incredible, really, Juan. I do believe that by being a participant of All of Us, you're taking the right steps towards reducing those disparities within many ethnic groups and improving the healthcare across the U.S. So I definitely would encourage, that we continue to participate in these type of opportunities so that there could be real change, in the healthcare field.
Yeah, I know one of the questions that always comes up is, what information do I have to share? Is it safe, for example? And so what we understand is, right, when it comes to electronic health records, blood, urine, and saliva samples, for example, all this information is anonymous, right? It's stored securely for all of the participants in the actual program itself. And I think that's one of the important aspects that people really don't understand.
All right, Juan. Well, yes, I believe that a lot of people are concerned about their privacy, and these details are obviously very important when it comes to our healthcare records. And I do believe that preventative and holistic care measures can really successfully change the path of the healthcare system by using the data that All of Us research has. That provides a great opportunity for the underrepresented, and it really does help us to get more type of treatments offered to us. So I definitely believe that you all take care of our privacy and are capable of getting that data out in a way that doesn't jeopardize our privacy at all.
Yeah, I think the most important thing is just understanding that all of the data is encrypted, right? They remove anything that's personal identifiable information, for example. And most importantly, that it's not shared across government agencies or even with health insurance companies. All this information is really specific to the program, and it follows all the federal, state, and local laws and regulations for keeping information safe. Now, for me, it's a bit personal, right? So in my case, my youngest daughter, she was 4 years old when she was diagnosed with juvenile diabetes or type 1 diabetes. And in our family, no one in my family or my wife's family had ever been diagnosed with diabetes. My mother-in-law was diagnosed with type 2 diabetes in her 70s, right? But it was a shock to us, and it really highlighted the importance of understanding the risk factors, right? That can impact, for example, my son or other members of our family. And so, that's why this for me has become pretty personal. And I think it's really important and encourage as many people to participate in this program as well.
I agree, Juan. This is a great opportunity, and I hope a lot of more participants come along to represent us.
Okay. So, so participants in the program, it's really focused on research, right? You provide this data, you provide a sample, if you will, and then that helps really shape the program with inputs and the information that you've provided. Now, all the information, all of us actually shares with you, right? So being a part of the program for a very long time, you'll have access to increasingly deep record about your health. Now, if you visit one of the partner centers or to give a sample of physical measurements, you'll receive information including height, weight, and blood pressure. You can also learn about unique ways and traits about your ancestry and provide information about the program, about your DNA. It will take a little time, right? But you will learn a lot more about genetic risk factors, like in the case of my daughter, for certain diseases. Knowing that your risk may help you and with your treatment and healthcare providers is really an important portion of this. So, by participating in this program, you may learn a lot more about your body and how it responds to certain medications. And this will help you also when you are working with your healthcare providers, knowing a little bit more about which medications are best suited for you.
That's great. Yes, definitely needed. This type of program puts things in a different perspective for us and a good track to really change, like I said, what healthcare looks like for all ethnic groups.
Yeah. So ultimately, the goal is really to understand more about why people get sick and staying healthy, right? So taking part of this program is free, and it will only take a little bit of your time. So if you're interested in joining, you can visit joinallofus.org/together to sign up or learn more about the work of the program and how it's going to increase diversity in healthcare research. Do you want anything to add to that, Erika?
Just continue to encourage everyone to really take those steps into, reducing the disparities, like I said, within many ethnic groups and improving our healthcare. So take that time and sign up for All of Us research.
Wonderful. So that'll be all for today's Cafecito. Remember, we will have other Cafecitos related to All of Us research programs, and are looking for more people to join us. So stay tuned. Erika, so nice to meet you. Thank you so much for joining me today. I really look forward to having a chance to meet in person soon.
Yes, Juan, thank you. You have a great rest of your day.
Enjoy Puerto Rico.